Hello dear viewers. Today we are going to talk about preeclampsia, a common complication during pregnancy. We will understand this condition, which occurs after the second half of pregnancy and is characterized by high blood pressure, and other complications, explore its causes and examine treatment options. It is very important to understand and be aware of this important topic for a healthy pregnancy experience. Now, let's take an in-depth look at preeclampsia, the poisoning of pregnancy. Pregnancy intoxication is high blood pressure and elevated protein levels in the urine that occur during pregnancy. High protein levels can cause damage to other organs, especially the kidneys. Swelling of the hands, legs, and feet is the most common symptom. Preeclampsia is a serious condition that can endanger the mother and baby. The most characteristic symptom of pregnancy intoxication is hypertension. This may be accompanied by swelling throughout the body. Pregnancy intoxication can also be detected in some women during routine pregnancy follow-up. In general, some of the symptoms of pregnancy intoxication are as follows: rapid weight gain due to edema problems, some vision problems such as blurred vision, sensitivity to light, and temporary vision loss, pain in the upper right side of the abdomen, shoulder pain, severe headache, nausea and vomiting, dizziness, less urination, mental state changes, weakening of reflexes, elevated levels of protein in the urine indicating kidney problems, decreased levels of platelets in the blood, increased liver enzymes indicating liver problems, shortness of breath due to fluid accumulation in the lungs. The cause of pregnancy toxicity is not entirely clear. However, some health experts have reported that it can be caused by abnormalities in the lining of the placenta, commonly known as the baby's partner. Problems with the blood vessels in the placental lining can cause blood pressure problems in the expectant mother, putting her at risk of preeclampsia. When pregnancy poisoning is suspected, doctors use some medical evaluation methods for definitive diagnosis. Some of these methods are as follows. With blood tests, liver and kidney values are checked and blood clotting is checked. Urine tests are used to analyze how well the kidneys are working. Fetal ultrasound is the monitoring of the baby in the womb by ultrasound. In this way, the baby's weight and the condition of the amniotic fluid are monitored. The non-stress test monitors the heart rate when the baby moves. The biophysical profile examines a series of parameters to determine the baby's well-being. A normal person has a blood pressure of 120/80ths. During pregnancy, a slight increase in these values is considered normal. However, a blood pressure of 140/90ths or higher during pregnancy can be a sign of gestational hypertension or other health problems, including preeclampsia. Preeclampsia is a condition that generally tends to improve within 48 hours after delivery. In many pregnant women with this condition, symptoms improve shortly after delivery. Liver and kidney values return to normal within a few months. However, preeclampsia can reoccur 48 hours to 6 weeks after delivery, even at a low rate. For this reason, regular monitoring of blood pressure and blood values is necessary. Preeclampsia can harm the baby in the womb, as well as the pregnant woman. The most common complication of this condition is developmental delay in the baby. This is due to insufficient blood supply to the baby through the placenta. The baby receives less oxygen and nutrients than it should. The treatment of pregnancy intoxication can vary depending on the severity of the condition. If the condition is severe, it can put the life of the mother and baby at risk. For this reason, doctors may decide to give birth for definitive treatment. However, if preeclampsia does not cause serious symptoms and the baby is well positioned in the uterus, Alternative methods are used. Some of these methods include bed rest at home or in hospital, frequent monitoring of the baby's heart rate, use of drugs that lower blood pressure, regular monitoring of blood and urine values, steroid medicines to accelerate the baby's lung development, use of magnesium to prevent seizures. In the mother, pregnancy intoxication is not preventable. However, risk factors can be reduced in some pregnant women. Whether there is such a risk can be determined by doctors who monitor pregnancy. Some of the measures to be taken to reduce the risk of preeclampsia in pregnant women are as follows. Medication is used in cases of moderate to severe risk of preeclampsia in pregnant women. The treatment, which is recommended by doctors and begins to be used after the 12th week of pregnancy, includes blood thinners. Some poor lifestyle habits before and during pregnancy can increase the risk of preeclampsia. Some of the measures that can be taken to prevent this condition are as follows: keeping blood pressure and blood sugar under control, ensure weight control, quit smoking if you smoke, doing exercises appropriate for pregnancy, creating a healthy eating program. If you are pregnant and are experiencing some symptoms that indicate pregnancy poisoning, do not neglect to consult a health care provider. Pregnancy toxicity can be a condition fraught with serious complications such as high blood pressure, but with knowledge and awareness you can deal with it. Remember that every pregnancy is unique and every woman can have different experiences. Thank you for watching this video. If you or someone close to you has any concerns about preeclampsia, please contact a health professional. Your health and the health of your baby is paramount. For more information and support, please talk to your doctor or health care professional. Be aware and careful to protect your health and have a healthy pregnancy experience. If you would like to see more videos on other topics, be sure to follow our channel. We will always bring you new and informative content. Have a healthy day.